Good morning. You wake up and maybe you notice something's different. Fewer mornings with firmness, or that sense of readiness just isn't there. Or perhaps your mornings feel hesitant, even after full sleep. If that resonates, here's the truth. This isn't just aging. Your body is sending a signal worth listening to. Morning erections aren't about vanity. They're a dashboard light for vascular health, nerve function, sleep depth, and hormone rhythm. A urologist-backed check is simple, and I'm showing you exactly what morning firmness says about your health, how to check it quietly, and one nighttime habit to avoid so your signal stays clear and reliable. If you're finding this helpful, like this video, comment with your age and country, and subscribe for practical senior health guidance. What does morning wood indicate? When a man over 60 wakes with natural firmness, several things are working well together. Your vascular system is delivering reliable blood flow to all your body. The same circulation that creates an erection feeds your heart, brain, and muscles. Nerve signaling is intact and responsive, meaning pathways between your nervous system and body communicate clearly without interference. Sleep depth is adequate, especially REM stages, where the body does most restoration work and growth hormone pulses accelerate cellular repair. Hormone rhythms, particularly testosterone peaks in early morning, are cycling normally and synchronized with your wake-sleep pattern. Altogether, this creates a reliable signal of whole-body recovery and readiness. When morning erections become less frequent, weaker, or disappear over weeks, it's a nudge to examine sleep, stress, medications, blood pressure, blood sugar, or cardiovascular status. Occasional absences are completely normal. Every man experiences them, but persistent decline warrants attention. Your body's saying, something in my recovery cycle needs attention, and that's valuable information you can actually act on. Why does this signal get noisy with age? Lighter sleep from late screens or caffeine fragments, REM stages where erections naturally occur 3 to 5 times per night. Blue light actively suppresses melatonin, keeping your nervous system alert when it should wind down. Erratic bedtimes blunt hormone rhythms that peak in early morning. Certain medications, blood pressure drugs, antidepressants, pain medicine, can dampen erections or fragment sleep. Elevated blood pressure or blood sugar affects vessel elasticity and nerve signaling. Chronic stress keeps your nervous system in fight or flight mode overnight, suppressing parasympathetic activation needed for deep sleep and erections. Evening alcohol fragments REM sleep dramatically and causes multiple bathroom trips that disrupt sleep further. All these factors create noise on the signal. But here's what matters. The goal isn't chasing youth. It's reading this dashboard light and making small adjustments that help your body's recovery cycle work smoothly, which naturally supports steadier mornings, clearer thinking, stronger first steps, and more reliable energy and confidence. Here's how to do a simple morning check taking just seconds. When you wake, before getting out of bed, notice whether there was firmness in the last few minutes of sleep or on waking. Like noticing whether your joints feel stiff or loose, without any judgment. Pair that observation with how rested your body feels overall. Are muscles relaxed or tense? Do first steps feel steady and strong or wobbly and hesitant? Does your mind feel clear and ready or foggy and slow? Is your mood stable and patient or reactive? Altogether, these paint a complete picture of sleep quality and overnight recovery. One day proves nothing, but patterns over 1 to 2 weeks emerge clearly. Maybe you notice that mornings with firmness also show deeper sleep, steadier steps, clearer thinking, calmer mood, and better focus. Or the opposite. Shallow sleep correlates with absent morning signals, unsteady steps, and mental fog. These patterns are genuinely valuable and tell you exactly which nighttime habits are supporting your health. Treat this as a quiet, private check-in that helps you understand your body and guides conversations with a clinician if needed. No performance pressure, no testing, just gentle, honest awareness. Let's talk about mechanism lightly while connecting to what you experience. Deeper sleep, especially REM stages, is strongly associated with reliable nocturnal erections. Your body cycles through REM 3 to 5 times per night during healthy sleep. And during each cycle, the brain naturally orders blood flow downward as a system health check. During REM, the parasympathetic nervous system dominates, the rest and digest branch favoring blood vessel relaxation, engorgement, and calming away from alert mode. Morning testosterone peaks naturally rise in early waking hours, and when sleep is deep, these hormonal pulses align with a firm, ready body that feels confident and capable. The same vascular health creating morning erections keeps blood vessels flexible for your heart, brain, and muscles. Arterial flexibility is arterial flexibility everywhere. The same nerve signaling keeps balance steady, touch sensitive, movements coordinated, and mind responsive and clear. So what's good for morning signals is genuinely good for your whole body: cardiovascular health, neurologic function, metabolic health, energy levels, mental clarity, emotional resilience, and overall vitality. This is why clinicians look at this message seriously, not as vanity, but as a window into systemic health and a powerful indicator of whole body wellness. Build a gentle nighttime routine that's realistic and doable for every lifestyle. Start by cutting caffeine earlier. Finish all coffee, tea, colas, and caffeinated drinks by noon, ideally by 1 o'clock. Caffeine lingers 6 to 8 hours, and if you're having it after 1 or 2, it still circulates when you're trying to sleep, fragmenting deep sleep and suppressing REM stages where erections would naturally occur 3 to 5 times per night. This single change often improves sleep noticeably within 3 to 5 nights. Begin dimming lights 1 to 2 hours before bedtime. Bright overhead lights suppress melatonin and keep your nervous system in daytime mode. Switch to softer, warmer lighting, lamps instead of ceiling lights, or keep overhead lights at 30% brightness. 30 to 60 minutes before bed, put screens away entirely or use blue light filters on dimmest settings with blocking glasses because blue light actively suppresses melatonin exactly when it should be rising. Consider evening eating patterns. Heavy meals within 2 hours of bed fragment sleep and cause nighttime awakenings. Aim to finish dinner 2 to 2.5 hours before sleep, allowing digestion time while preserving restful sleep. If you need an evening snack, keep it light: nuts, fruit, or cheese. Avoid sugary foods. They spike blood sugar, then crash, potentially causing mid-sleep awakenings where you jolt awake. Review your supplement routine carefully. Some people take stimulating supplements at night: high-dose B vitamins, caffeine, herbal stimulants like ginseng, thinking they'll help next-day energy, but they actually fragment sleep and suppress REM. Move stimulating supplements to morning, keeping evening routine focused only on truly calming support. Set a consistent bedtime window within 30 minutes each night. If you want to be asleep by 10, start winding down by 9. Go to bed between 9:40 and 10:20. Your body's rhythm thrives on rhythm. 5 to 10 minutes before lying down, try this simple practice. Sit comfortably or lie on your back and breathe slowly. 4 counts in through your nose, 4 counts holding gently, 4 counts out through your mouth. Do this 6 to 8 times. This activates your parasympathetic nervous system, allowing deep relaxation, blood vessel opening, and downshift from alert to recovery mode. Then gently stretch legs, calves, hamstrings, and hip flexors for 1 to 2 minutes to release lingering tension that keeps you tossing. All this together, done consistently, nudges your body from alert mode into genuine recovery, where deep sleep and morning readiness actually happen. Now, what you absolutely must avoid at night: combining evening alcohol with sleep routines. Alcohol fragments. REM sleep dramatically. You fall asleep faster, but sleep quality is shallow and broken, missing critical REM cycles where 3 to 5 nocturnal erections would naturally occur. Alcohol initially depresses the central nervous system, so you fall asleep quickly, but then metabolizes into acetaldehyde, which is stimulating and causes multiple awakenings throughout the night and total REM suppression, especially in the second half of the night when most REM occurs naturally. Additionally, alcohol is a powerful diuretic, increasing nighttime urination and causing multiple bathroom trips that fragment REM further and interrupt cycles where morning signals would happen. If you enjoy an evening drink, move it earlier in the day, lunch or early dinner around 5 or 6, and give your body at least 4 to 6 hours to metabolize it before sleep. Even 1 or 2 drinks within a few hours of bed suppress REM and blunt your morning signal the next day dramatically. Some men also combine evening alcohol with stimulating supplements or caffeine, creating a triple disruption that guarantees fragmented REM and poor sleep. Keep your evening routine intentional and protective, calming activities only, soft lighting, consistent timing, sleep-supportive practices only. If you've been combining evening alcohol with sleep routines, simply moving that drink earlier in the day creates noticeable differences in sleep depth and morning messages within just 3 to 5 nights, often dramatic enough that you'll notice immediately and stay motivated to maintain the change. Tonight's checklist. If you're having caffeine afternoon, commit to finishing by noon starting tonight. That's your first anchor point. Check your lighting and switch to softer lamps or warm mode lighting around 7 or 8, depending on bedtime. Put screens away at least 30 to 60 minutes before bed, or switch to warmest, dimmest settings with blue light blocking glasses. Review evening eating and aim to finish dinner by 7 if your bedtime is 10, giving a 2.5-hour digestion window. Review evening supplements, moving stimulating ones to morning. Check for B vitamins, ginseng, or any herbal stimulants. Set a specific bedtime window tonight. Pick your sleep time. Write it down. Start wind down 40 minutes earlier. Stick within 30 minutes of that time each night for 2 weeks so your body learns the rhythm. Before bed, do the breath practice. 4 counts in, 4 counts hold, 4 counts out 6 to 8 times, then gentle stretching for 1 to 2 minutes. Wake tomorrow and simply notice any morning firmness or sense of fullness without judgment or performance pressure. Check how rested you feel, how steady your first steps are, how clear your mind feels. Write a quick note tracking patterns. Repeat each morning for 7 nights and observe what emerges. 3 approaches depending on where you are. Simple version. Move caffeine cutoff to noon starting tonight and see if this single shift changes sleep depth and morning signals within a few nights. Complete version. Add consistent bedtime within 30 minutes. Dimmer lighting 1 to 2 hours before bed. Screen shutdown 1 hour before bed. And breathing and stretching practice. Optimized version. Include all above plus evening supplement review and switches. Move evening alcohol earlier if applicable. Consistent dinner timing finishing 2.5 hours before sleep. Limit fluids in final hour before bed if nighttime trips disrupt sleep. And conscious tracking over 1 to 2 weeks, noticing patterns. Any level is completely valid and worth trying. No wrong starting point. No judgment about which feels right for you. What matters is consistency, because that's what trains your nervous system to expect calm and recovery, supporting deeper sleep, steadier hormones, stronger morning signals, and whole body vitality over time. Few sensible cautions offered in a supportive voice. Some medications, antidepressants, blood pressure drugs, pain medicines, sleep aids, influence erections or sleep depth, so if you've taken new medications recently and noticed changes in morning messages or sleep quality, a conversation with your doctor or pharmacist about timing, alternatives, or medication timing matters greatly. Medical conditions, diabetes, cardiovascular disease, sleep apnea, neuropathy can alter the message. So if you have these, understanding how they affect your signal warrants serious discussion with your clinician. Sudden changes in the message or persistent pain warrant immediate medical attention, not just habit changes. High blood pressure, elevated cholesterol, or borderline glucose levels reduce morning message reliability significantly. So if you haven't had basic checks, blood pressure, lipid panel, fasting glucose, recently, those conversations make sense with your doctor. If you're waking multiple times to urinate, REM sleep is disrupted, and morning messages fragment. This can sometimes relate to evening fluid intake, but it can also signal urinary tract issues, prostate changes, or other medical concerns warranting evaluation. If you combine evening alcohol with late meals or caffeine, all three together create triple disruption to sleep depth, making morning messages nearly impossible to read. In that case, remove the most potent disruptor first, usually alcohol, and see how things change within 3 to 5 nights. If you combine these habits and want to improve, start with alcohol elimination, wait 5 days, then tackle the next habit. These conversations are smart steps toward understanding your whole health picture, not signs of weakness or failure. Leading clinicians genuinely want you having them. If this information resonates, and you're realizing how important nighttime routines are for morning messages and overall health, make sure you're subscribed so you don't miss future guidance on sleep, cardiovascular health, hormone balance, vascular function, and whole body vitality for men over 60. The connection between nighttime recovery and morning readiness isn't about one aspect. It's about everything that makes life worth living. Frequently asked questions. Does lack of morning messages always mean low testosterone? Absolutely not. This is crucial to understand. While testosterone plays a role, the message depends equally on sleep depth, vascular health, nerve function, blood pressure, blood sugar, stress levels, and medications. A man can have normal testosterone, but poor morning signals due to fragmented REM or high stress. Conversely, borderline testosterone but reliable mornings if sleep is deep and cardiovascular health is solid. The message is multifactorial. Good news because you have multiple levers to pull. Are occasional absences normal? Absolutely, and this deserves emphasis. Every man experiences nights without morning signals. Stress, poor sleep one night, alcohol the evening before, unusual late dinner, or random variation. What matters is the pattern over 1 to 2 weeks, not any single morning. 3 bad mornings followed by 3 strong ones tells a story. 1 weak morning tells nothing. How do decaf and late eating affect the signal? Even decaf contains 10 to 15 milligrams caffeine versus 95 to 200 in regular coffee, and herbal teas contain stimulants like theobromine or caffeine. If sensitive, even decaf late in the day fragments sleep noticeably. Late eating activates digestion when your body should wind down, interrupting deep sleep. Eating 2 to 2.5 hours before bed allows initial digestion while preserving smooth sleep onset. What happens if I'm waking to urinate, disrupting sleep? Frequent nighttime urination can result from evening fluid intake, caffeine, alcohol, certain medications, or medical conditions like benign prostate hyperplasia or urinary tract issues. Start by limiting fluids in the last hour before bed to see if that restores sleep depth. If nighttime urination persists even with fluid restriction, a doctor conversation is warranted because it may signal a medical issue. How much do stress and poor sleep play a role? Enormously. They often work together. Chronic stress keeps your nervous system in fight or flight mode, suppressing parasympathetic activation needed for erections and deep REM. Poor sleep directly reduces REM stages where erections naturally occur. Better stress management, consistent sleep, gentle exercise, breathing practices, reducing evening stimulation often improves morning messages as much as any other single factor. Does exercise timing matter? Yes, significantly. Vigorous exercise within a few hours of bedtime is stimulating and delays sleep onset and REM initiation. Exercise earlier in the day, or at least 3 to 4 hours before bed, supports deep sleep optimally. Gentle movement like walking 10 to 15 minutes or light stretching closer to bedtime can help sleep onset without overstimulation of your nervous system. When should I discuss lab work with a doctor? If you're noticing persistent decline in morning messages over several weeks or have risk factors like family history of cardiovascular disease, diabetes, or hypertension, basic lab work makes sense and is worth discussing. Testosterone, fasting glucose or A1C, lipid panel, and blood pressure are all reasonable to check with your doctor as part of understanding the bigger picture of your health. These aren't just about sexual function, they're markers of cardiovascular and metabolic health that matter for your entire body, heart, brain, kidneys, and long-term vitality. Notice over first 7 days. Are you falling asleep more easily without tossing or racing thoughts? Are you waking fewer times or falling back asleep more quickly? Does sleep feel deeper and more restorative on waking, like you actually rested versus just lying there? Any shift in morning firmness or sense of fuller readiness that feels noticeably different from before? Are first steps steadier and stronger with more confidence? Is morning energy clearer or more grounded and purposeful? Is mood calmer and less reactive to frustrations? These early signals show sleep depth is improving, and your body's recovery cycle supports better function throughout your day. Most men notice at least 1 or 2 shifts within the first week, with easier sleep onset, fewer awakenings, and steadier morning readiness being most common early changes. Pay attention without judgment. Simply observe what's actually happening in your body and how you feel. At 14-day mark, changes should feel consistent, reliable, and automatic rather than occasional good days scattered among poor ones. Sleep should be deeper more nights than not, mornings steadier and more reliable more days than not, and energy and clarity throughout the day more consistent and sustainable. Morning messages, whether fully present every day or not, should feel steadier or more consistent than 2 weeks ago. Secondary benefits often emerge at this point: less muscle stiffness and fewer nighttime aches, better digestion and fewer stomach issues, clearer thinking and better focus during activities, improved mood stability and less irritability, more patience with small frustrations, better skin tone and appearance, and even deeper confidence in your body. All these signs show your body sleeps deeper, recovers more fully, and nocturnal processes supporting morning readiness and whole body vitality activate more reliably. Congratulations! You've proven to yourself this works. If noticing 1 or 2 shifts, drop a comment with your age, country, and one specific change you noticed: falling asleep faster, steadier mornings, clearer mind, or sleeping through the night. That single comment helps other men see what's possible and gives encouragement to stay consistent. What happens next? In comments below, share your age, country, and which evening routine part you're trying tonight: cutting caffeine by noon, setting consistent bedtime, dimming lights, stopping screens earlier, moving evening alcohol earlier, adjusting dinner timing, finishing 2.5 hours before sleep, or doing breathing and stretching before bed. Which one feels most doable for you? If this made sense, and you want more science-backed guidance on steadier sleep, reliable morning messages, cardiovascular health, hormone balance, and whole body vitality for men over 60? Subscribe. Tonight isn't just another night. It's the moment you begin supporting your body's natural recovery rhythm. And when that rhythm works smoothly, everything else, energy, confidence, strength, mental clarity, stability, morning readiness, and self-assurance, naturally falls into place. Paying attention to this quiet, powerful signal is a smart, dignified, deeply effective way to support your health, and starting tonight means you could wake tomorrow already noticing the first changes emerging in how you feel.